do it. Just make like a giddy up sound. And you can feel kind of like the middle of the third of your tongue is working. And oh, geez, here we go again. Hello, welcome to The Spot for Health. My name is Shirley Kutkowski, your host of all things that are healthy, including things that are of the mouth. And that's what we're going to be talking about today. The Spot on Health is where we get to show you, the community, where to go for health in Sun Prairie. And today I've got a guest that came from far away from Sun Prairie, originally from the Chicago area and now from Tucson, Arizona. She's a friend of mine, Pat Pine. She's been a dental hygienist for over 30 years, and she attended a course on myofunctional therapy. Her son's picture kept popping up in her mind as she was learning about this myofunctional therapy, which is what we do at Primal Air. Pat then realized how her son, as an infant, had many disorders that were being described during the program. She never realized that her son's tongue tie, never diagnosed during infancy, was the cause of many of his health issues. Pat felt she wanted to help other children, and she created Muscles in Harmony, which is her business name, about 4 years ago. The muscles of the face and tongue are not working in harmony with many health issues, and many health issues can occur, hence we want our muscles to be in harmony. Pat established her practice with her son in mind and many other children that have slipped through the cracks of not being diagnosed and have had to deal with unhealthy life happenings and issues. Pat has many patients that fall into this category and is very interested in helping them lead a healthy, normal life through neuromuscular re-education of the muscles of the face and tongue. And I know it works wonders. I've seen some of the pictures that you've shown in our professional email community, and everybody's doing a little bit of magic with their myofunctional therapy practice.
Well, we didn't know what we didn't know. And so now that we have a handle on what's causing some of these issues with these children, falling asleep in school, not breathing correctly, they've even connected it to ADD and ADHD. And it's the breathing because the tongue is in the wrong position. He's not where he's supposed to be. So in other words, the whole face is restructured because the breathing isn't proper, the tongue isn't in the correct position. So there's a lot of issues that we were unaware of, and I, as a dental hygienist, was unaware of until I took this course and then, of course, went on for more education.
Right, and it is something that I know I learned in dental hygiene school. I graduated in 1986, and we did have a unit on myofunctional therapy, but once we got out into the world, that was like never, ever mentioned ever again. It's 60 years old. Right.
I hate to say it that way, but years ago, one of the issues in today that's kind of become on the top of the list of a lot of new moms is the tongue tie and the lip tie. And what they used to do years ago with the midwives is actually take their longest fingernail, and when the baby was born, they would just go ahead and cut that little membrane under the tongue. We didn't have all these issues. It sounds brutal, but the baby didn't know it. And I'll be honest, it can't be any worse than a circumcision.
I was just going to say, they don't do anything for that either. So, but it's really important and it's really new. And I think what's happened in the 60s and 70s, everybody was kind of getting a little bit more hands-off on parenting. They weren't, close your mouth.
Right.
They weren't chew with your mouth closed. Let them go. It's fine. They'll be okay. Well, maybe not.
Yeah, we're finding out that wasn't the best thing to do. But then again, back then, we didn't know what we didn't know.
Right.
So now we have all this information. We're trying to share it with the public, trying to get these children to breathe normally, have their face develop correctly instead of a long, skinny face. And when they're not breathing correctly, this mid part of their face does not develop properly. So parents, we go to the orthodontist, but this is a little bit more than that. We need to make sure that things in the muscles of the face and the tongue are doing their job. And it starts at birth.
Right. And one thing that will tip off a mother is painful breastfeeding.
Mm-hmm. Well, that's what I had with Kevin. I did not breastfeed because I was going into hygiene school, but we bottle fed, and he gulped that down so quick, and then he'd scream bloody murder, and then they told me that he was colicky. Well, he wasn't colicky. He drank so fast and he collected air. He sucked in air from the corners of his mouth with the bottle. His tummy then would get really hard as a rock, and then he'd also get sick. He'd throw up. So they were like, they didn't think anything of it. They wanted to put him on medicine. Well, I wasn't a medicine mom, and I said no. And so we dealt with it, and as he grew older, we discovered at older 21, he goes, Mom, I keep getting this tissue caught between my two front teeth down here when I talk. I'm like, what? And we had it lasered and we had it released, and that has helped him immensely. And he's breathing better because that tongue lays back into the throat, and really he couldn't breathe. So he was also breathing through his mouth. And these are things we think are normal as parents, and I didn't realize all the issues that were occurring. He had a lot of sinus issues, a lot of allergies. This all plays a role in myofunctional therapy. That's what we correct. That's what we help these kids with. Orthodontic work will correct the smile and where the teeth are going, but myofunctional therapy can also be a big part of it.
There are a lot of orthodontists who are working with myofunctional therapists because they're realizing too that if the tongue isn't in the right spot, then the teeth are always going to be under adverse pressures.
Correct.
And that's another thing that myofunctional therapy is geared towards.
Well, I have a patient who's 17 and had spent $10,000 on her orthodontic work, and came to me afterwards, after the braces were removed, that the tongue was thrusting and opening up her bite. So now I came into play at the latter end. I would prefer earlier the better, but it worked out this way, and we are correcting that now. So we are putting that tongue in its place, so to speak, and teaching the tongue. We're re-educating that muscle to do what it's supposed to do. And we also have to re-educate the muscle so that the person or the patient can chew and make a bolus and swallow correctly, because when the tongue is not in that position, kids will gag easier. There's a lot more to it, and the swallowing is very important, and how big of a bite they take. Are they a messy eater? That all plays a role with us for myofunctional therapists, that we are looking for kids that have these habits and issues that we just think they're a boy. They just eat this way. That's not the case. There's usually some disorder or something going on.
There's a reason why they're not chewing their food, they're gulping their food. A couple of clients that I've had have learned how to take smaller bites and spend an extra couple of seconds chewing their food. It's not a race. And if your tongue is tied, or if it's not in the right position, or it has some other habits that it's become used to over time, you're just shooting the food down the pipe, and you're not getting the benefit of the food even.
Well, the enzymes aren't mixing, the enzymes in the saliva are not mixing with the food. Well, then when it's swallowed, the enzymes in the stomach are not mixing. There's too much food in there. So their digestive system, which my son also had issues with, was a big deal. And also kids today, starting from infancy, are eating softer foods.
Oh,
they don't want to
don't get me started.
Yeah, they don't want to chew the hard, crunchy foods. They can't do it. And sometimes it's the muscles of the cheeks that are not formed correctly, or the muscles aren't toned correctly so that their food stays inside their mouth. So this is what we do. We straighten out all of the muscles and make sure that they harmonize with each other.
So really, a child that won't chew food is exhibiting a symptom of a myofunctional disorder of the facial and tongue muscle.
Correct.
That's really kind of the short end of it. So all of these foods that are pureed, these pouch foods that are like, holy cow.
Yeah.
You know, the parents.
It's convenience.
It's convenient. The parent thinks that they're doing their kid a service by providing them vegetables they will eat, but really you're only getting a tiny fraction of the benefits of the food.
Well, and think of it on the dental hygiene part of it. The food also cleans our teeth. So if we're not eating food, the plaque is staying on the teeth, and the food, like an apple, we always say an apple a day keeps the doctor away and possibly the dentist, because we're chewing that apple and it's cleaning our teeth at the same time. So carrots, celery, I mean, okay, put a little sugar-free peanut butter on it or things like that, but we need our kids to chew regular food, not pureed and not applesauce and all those kind of things, because it's easier for them to swallow. So think of this, if it's easier for them to swallow, why can't they swallow regular food or peanut butter and jelly or breads or things like that? So there's something going on, and possibly their tongue could be tied and preventing them from swallowing healthy, normal vegetables and fruits. So we have to think into that perspective that there's a reason that this is going on.
Chewing is more important than what we've ever really thought. On my podcast, I interviewed Dr. Mew, who is a third-generation orthodontist in the UK. And he said something at the meeting that we were both at in September that got the whole audience like, bzzz. And I thought, we're a bunch of envelope pushers, and to give him, a sour face, I guess it's the mildest way of saying it, for bringing up the idea of using chewing gum as a therapy for his patients was just over the line for me. So I interviewed him, and what he's doing, based on the experiences that he's had so far, his father has had, and his grandfather has had, he is asking all of his 3- and 4-year-old patients to chew gum for a full hour a day. Wow. It doesn't have to be for a 1 hour, but 5 minutes here, 10 minutes there, and to stimulate the facial muscles and exercising the maxilla. So the maxilla is the roof of the mouth. It is also the floor of the sinuses. And if that's not growing, you're not getting air. And if you're not getting air, you're doing all kinds of things like you mentioned, falling asleep in class, being twitchy during class, not paying attention, behavior problems, pinching neighbors, in your classroom. All of that kind of naughty kid stuff is coming because of the airway.
Well, and to add to that is thumb suckers.
Oh.
So if you have a thumb sucker, what happens? You're pushing the thumb on the palate, and okay, I was one. So I push the thumb on the palate, and I'm sucking, sucking, sucking. So that's the floor of the sinus, which now if your sinus is, just for example, this wide, and you're pushing this up, you now have a smaller sinus, which then could also have a lot of allergy problems, you can't breathe correctly. So not only do we work together with myofunctional therapists, we work with ear, nose, and throat doctors, we work with cranial sacral doctors, we work with breastfeeding consultants. There is a whole team and group of professionals that we work with in order to get this child to live a normal, healthy life. And I think it's very important because nowadays you can go to the pediatrician, and I'm not picking on pediatricians, but they don't have a lot of time with their patients. I think it's 15 minutes. And so we help the pediatricians, maybe they're unaware of myofunctional therapy. Maybe we need to get out there more and help them. But it all starts at birth. So I'd say that those are the doctors that we need to really introduce to us and have them understand what we do for their clients also.
And it's really hard to help people understand. First of all, we have a name that's 40 miles long. Right. It's a lot of letters. I've never counted, but I'm sure it's a lot more than, normal. And orofacial is pretty simple. Oro is the mouth, facial is the face, myo is muscle, and therapy. I mean, it's really simple if you know Latin. Not everybody knows Latin. So there we go. And there we sit with our big, long title. And that's, why I went into this too. I had 5 sons, and all of them had symptoms of airway problems looking back. I had one kid that was a thumb sucker, and it took a long time to get him to be able to get rid of his thumb, but he still wasn't, his teeth were straight, but the behavioral problems were still there. And a lot of different things like that were happening in our family, a lot of what you've already mentioned. So this, to me, was a real eye-opener. There's one video that I'd like to recommend to everybody to go to YouTube and look up Connor Deegan, Finding Connor. That is probably the most compelling video that you will ever see about airway and how this child was suffering, and he was practically going to be institutionalized.
And thank goodness for his mother that
yes,
she would
just
not
asking
give up.
one more question
oh my gosh.
and looking.
She was determined that this was not her son acting like this, but there was her son inside of him. And the other, you had mentioned behavioral problems. Well, mothers are like, well, he's a boy, he's a kid, or a girl. It could be either one. But here's what happens is the kids aren't getting sleep because they're not breathing properly, and they're tossing and turning, and they're grinding their teeth at times. And that grinding is actually telling the body to wake up. And it is a symptom. They're having an issue. They find that a lot of our kids in today's world have sleep apnea. Why? Well, we're here to help, because what happens is they're not sleeping well at night. They have to get up for school in the morning. Mom gets them maybe breakfast, maybe not. They get off to school, and they're so tired they don't know what to do with themselves, so they start acting out because that's all they can do. That's what their body wants to do. So yes, that video is absolutely phenomenal. And kids that have behavioral problems in school, there is more behind it that maybe the pediatrician doesn't even know how to handle or doesn't know anything about what we do. But we help in that situation.
Exactly. And I'd like to also point out that there are a lot of adults who grind their teeth, and they're wearing night guards, and they're wearing appliances, and they're not really nobody's gotten to why they're grinding, and it could be too that they are suffering from an airway disturbance. It could be that the tongue is falling back, or some people just have a really tiny little chute for the air to go through.
Well, let's admit it, as we get older, we put on a little bit of weight. When we put on weight here, we tend to have snoring erupt. And I have a lot of female, the wife of the husbands that's call me saying, do you take care of snoring? We do take care of snoring to a point, but it is something that we can help to a point. But there is a lot of people that are out there that won't wear their CPAP machines. They won't go to the doctor. Oh, snoring's normal, every guy snores. Well, it can be life-threatening. So you should see a myofunctional therapist would be the first step. And then we can take it from there and refer you to who we feel would be best suited for whatever situation you have.
So the statistics on CPAPs are really dismal. So only half the people that have a snoring issue or have a sleep apnea issue will even seek medical attention for that. And the people who go and get prescribed a CPAP machine, only half of them or less will even wear the CPAP. And when we think about this whole thing, we've got Reggie White, who didn't wear his CPAP machine. We've got the Reggie White Foundation that will give you a CPAP machine or find a way for you to get a CPAP machine. That's right here in West Allis. And we also have myofunctional therapy that can help you become accustomed to your CPAP at the very least, and maybe make it more effective. The recent paper that was put together in 2015, October, was a meta-analysis of a bunch of myofunctional therapy papers, and they found that aggregating those papers together, people who had myofunctional therapy had a 50% better apnea-hypopnea index than those who did not, and children benefited even more. They had by 62% their AHP number was
Well, not
less.
only do we re-educate the tongue and the muscles of the face, but we tone them. So, like I said, everything kind of moves south when we're older, unfortunately, and so we do tone the inside of the mouth and the throat. So it can help.
Who would have thought of that? So earlier, I mean, we have my favorite little chewing gum here, and we were talking about chewing gum, and Philip was telling me the other day that somebody at where his other job, was commenting on his chewing gum style. And that's one of the tools that we use in myofunctional therapy to get the face to work and give it some exercise, but to use the gum on both sides. I was told that years ago, and I was like, well, whatever. Blah, blah. But now I'm like, never ever chew one piece of gum.
Now she's paying attention.
Everything's new. So that's what Philip's doing, is he's running around town now with chewing gum on both sides of his mouth. The xylitol obviously has some really good benefits on top of that. And just so...
Or a sugar-free gum will work.
A sugar-free gum, as long as it's not sugared, I guess.
Yeah.
And use it on both sides. Otherwise, you're just building one side of your face. The benefit of a xylitol gum is it's only tastes good for 5 minutes. So after about 6 minutes of exercise, you're like, pah, pah, pah.
But the benefits of it long term are there. So as far as caries go and things like that.
So what else do you use in your practice that helps people tone their face? What, at the beginning of today's appointment or today's visit, we were talking about, the middle tongue and doing that giddy up thing. So what other kind of things are there?
Well, it depends on the patient, of course. Everything's customized to what the patient's needs are. I do use party blowers. And a party blower is used so that the patient just breathes through their nose, not through their mouth.
Is there a party blower in this bag?
I believe there is, unless Shirley took it out for herself.
I did not take it out for myself.
Oh, it is in here. So, let me see if I can do it. So this is a new party blower.
Let's have a party!
So, yeah, woo-hoo! And that's what it is in myofunctional therapy. It's fun. There's a lot of fun because, first of all, we're dealing with kids. I deal with infants that are tongue-tied or have problems breastfeeding or bottle feeding. So I see a lot of babies. And then the other, the regular, adult kids or younger kids. I have a 4-year-old who was tongue-tied for 4.5 years and could not speak.
Ooh.
So this is another thing that we can check. If you have a child who is not speaking correctly, send them over. Let us do an assessment on them because sometimes it's the tongue. Sometimes nobody's aware of what it could be. And we do work with speech-language pathologists.
Okay, show me how to use the blower.
Well, it's supposed to be in slow motion, so I'm not quite sure. You put it in front of your teeth, you bite down, and we have a magic spot. So our tongue has to go on the magic spot in order to do this, but I can only breathe through my nose. So if I turn purple, you'll know.
That's not slow. There we go. That was a little slower. So you're trying to control the little paper tubey thing.
And it takes a bit to do this. It's
Sounds
not
like
overnight. So myofunctional therapy is something that you can't just give them exercises and go on. This is to help you long term for an entire life. So it's something that we teach the kids and they learn. And of course, kids learn a little quicker than us adults. And this goes in slow motion out and slow motion in. So they take this home, they get a goodie bag, a supply bag. And they take
like
this home.
Right? You go to the dollar store and you get a bunch of bags.
I get all their supplies from a variety of places, and then I teach them their exercises, and they have 3 to 4 a day. And then as they get really well at those, then I go ahead and add some on. So we always start at the beginning and then go on. I probably have 400 different exercises, but not every child gets all of those exercises. Right. So it just depends on the person and what we're doing. A tongue thrust is a thumb sucking. Some of them are repetitive. Some of them we go back to. This isn't working, so we pick out another type of exercise.
So the interesting part, too, about myofunctional therapy, you do a lot of speaking and you travel around the United States, and I do, too. And a lot of our patients are seen via the internet. So that's another really cool feature of our practice, that we don't have to have people right in you have your practice in your home, and I have a practice here on Main Street. And so it's important to know that you don't have to come for the appointments. Do you have weekly appointments?
I have weekly appointments the same time every day or every week, the same day. That seems to have worked very well because then the patient does have some routine. And then the patient practices twice a day. So we don't want to overload the patient, but we want to make sure that they have enough that they can do to strengthen these muscles and tone them and work with the tongue. So it works out very well. I use FaceTime or Skype or Uvu or whatever we need to use. Long distance isn't an issue. I have patients that are in California that I see in Arizona. So it's worked out very well for me. And then I can't give you a time like, okay, it's going to take me 3 months, 3 weeks, a year.
Yeah.
It really depends on the patient. If the patient is routinely working at this twice a day, you know, it could be probably 4 months, maybe 5. It could be shorter. It's going to depend on what the patient's needs are. And that's what I go by. I can't just stamp something, okay, you're a year. It's just the same with orthodontic work. If the child isn't using the elastics or doing whatever they need to be doing, they're not going to get the end result that you really want.
Right, and I do the same thing. You know, we start with saying it's going to take a year, but if they do their exercises 3 times a day, like we recommend, and they're really into it, then we can be done in 6 months. The idea is that we clean up old habits and make sure that they're lost. Then we work on rebuilding new healthful habits, and then really that's what's at the end is the most time consuming, is to make sure that those habits stick. It takes a long time to get rid of a habit and to build a new habit, but following in a sequence, you have a better chance of having that happen.
Well, and it's neuromuscular, so that means that it's the brain talking to the tongue and the facial muscles. So we have to re-educate that brain because he's been doing something for so long. So if you're 10 years old, he's been doing this for 10 years, we have to break that habit.
Right.
And we have many ways, fun ways, to break those habits. And even if you're an adult, I do understand that the adults suck their fingers or thumbs. We can help break that, bite their nails. We also take care of people that help them not bite their nails, because that's pretty unhealthy also.
It's super unhealthy.
Yeah.
Yeah, we could go on. That's a whole nother half hour.
That's infection control.
That's a whole nother half an hour.
Yeah.
Well, Pat, I'm so glad that you had some time to come up here from Arizona to talk with me about myofunctional therapy. It's a fun topic. It's huge. It affects almost every body system, and it sounds magical when you talk about it, which is why it's hard for people to get their head around, because it sounds too good to be true. And then, of course...
Well, and if there's issues, you could go on my website, which is musclesinharmony.com.
And we have our Facebook page.
Okay, and I have a Facebook page also. So you can go on there and get more information, and then give us a call if you need some help. And we're happy to help you.
Excellent. So thank you, Pat
No
Pine,
problem.
for joining me today. This is Shirley Gutkowski for the Spot on Health. Thank you all for joining us today, where you can find a place for your health to come up and show up.
Have a healthy day.